how are we doing, and what is the scenario for the fall and winter?
Good to be with you, Nicole. We're not doing well. The United States of America. The fall, everyone said, was going to be problematic, but the denial by the federal government continued, right? The first mistake we made in this country was we had a federal government that denied the virus. Some may say lied about the virus, but you get to the same point. They denied it. They were not operationally ready. They were not competent. Then the experts said in the fall, the virus is going to come back. And here it is. It's coming back. Again, the White House is not prepared for it. They're not addressing it. Again, they're denying it. And we'll continue to see these numbers go up unless states, frankly, on their own, adopt strategies just for this resurgence. And once you get past the fall, then we have the question of the quote unquote vaccine, Nicole, that the president says weeks away. And then you're going to have to ask yourself, how do we administer this vaccine? This is a country that couldn't find masks and gowns and Q-tips. How do you now administer 300 million vaccinations? So there's a lot ahead, and we have to learn the lessons from the past 7 months, and we clearly haven't.
I want to press you on vaccines because I believe all governors, the National Governors Association has sent a letter to the White House today saying in part this: additional guidance and clarification is needed on the roles and expectations of states in a successful COVID-19 vaccine distribution and implementation plan. To that end, as chair and vice chair of the National Governors Association, we request a meeting with you and your team to discuss what is required to ensure a strong partnership, including but not limited to the delineation of federal and state responsibilities, the funding needs associated with those responsibilities, and the planned supply chain management and vaccine allocation process. I mean, Donald Trump's message to New York with the stimulus and on his Twitter feed has been basically go to hell. What is your expectation from Donald Trump's White House in terms of assisting you with the distribution of a vaccine for your state?
Yeah, Nicole, you're exactly right about New York. I think my psychological theory is that New Yorkers rejected Trump, and New York is his home state. And frankly, those who know the president best like him least. That's a problem he has to deal with when he looks in the mirror. But as chairman of the National Governors Association, these are Democratic governors and these are Republican governors. And this is learning the lesson, right? The White House talks about we're going to have a vaccine. It's in a number of weeks. And then what, Mr. President? Are you going to do what you did 7 months ago and the federal government throws up its hands and says, this is up to the 50 states? You states now have to figure out how to vaccinate your own population? Am I going to find out on some tweet that I have to vaccinate 20 million people? How do I do it? When do I do it? Are you going to provide funding for me to do it? You're already saying no to state funding and local funding, which means we're going to lay off the very personnel that would be administering this vaccine. To do this logistical operation, Nicole, you could plan for weeks. Government has never done anything this big in decades. And there's absolutely no conversation about it from the White House whatsoever. And again, this was the mistake we made in the beginning. How the federal government, which knew this virus was coming, took the posture that the federal government has no responsibility. It's up to the 50 states. The governors are in charge. When a problem is a problem for 50 states, by definition, that's a national problem. And that's why we have a federal government and a president who sits on top of the federal government.
Earlier in our show, it was described as an abdication of leadership to veer toward what the White House seems to have embraced this week, which is herd immunity. With the president who's flirting with herd immunity, who is still a recovering COVID patient himself, walking around without a masks and without socially distanced crowd, I guess what I'm getting at is, do you really think you're going to find a partner in the Trump administration?
No, I don't think it's just a leadership question. I think it's a leadership question with the president. I think it's a competence question with his administration. I don't think they know how to govern. I don't think they knew that they were supposed to govern. I think they thought this was just a public relations charade. You know, the president is fundamentally a marketer. That's what he does. I know him very well from New York. He was never really a businessman. He was a marketer. He was a licenser. He created an image and then he licensed his likeness, right? You open a hotel and I'll license my name. And I think that was his attitude as president. He never had any policy background. He never had any concern for public policy issues. He surrounded himself with a group of public relations people. So I don't think they knew how to govern. That they lied about the virus is a different situation. But they then abdicated to the 50 states. And now, coming the fall, where we knew the virus was going to come back, there's been absolutely no leadership. And everything the federal government does is a negative. You know, the president's fundamental problem are facts. His problem is the truth. The virus is coming back. It's not going away. It's not getting better. The numbers are going up. There is no vaccine. Yeah. Even once there is a vaccine, you have to figure out how to administer the vaccine. Herd immunity means many people die. That's what herd immunity means. New York, which had one of the highest infection rates, you'd have to go from 20% infection rate to 50 or 60%. You'd have to have thousands more people infected and die. How is that a plan?
I don't think it's a plan the public is ready for. I want to ask you about the book, though. First of all, there's been criticism of you for writing the book, and I'd like you to address that. But you admit some mistakes here, which is, I don't mean any disrespect, it is very hard for all politicians of all parties to do. But let me read where you do that. With the advantage of hindsight, we will say we should have made different decisions, such as asking people to wear masks sooner. A factor driving the fear for me was that the facts were already changing. The worst was a reversal in the belief that asymptomatic people couldn't spread the virus. We would have operated much differently if we had known that earlier. What else will we find out 6 months down the road? This to me underscores the fact that we still don't know that much about the disease. We don't know that much about long-term health effects. We don't know if our kids, who are some of them in school, some of them learning at home, where should they be? Should they be in school? Should they be at home? But you've been criticized for writing a book at what you yourself describe as the halfway point. How do you respond to that? And what do you sort of attribute the mistakes that you made and that you write about to here? Is it the science, or are they judgment things that you would go back and do differently?
Yeah, I wrote the book, Nicole, precisely for this purpose, to have this conversation, to say, let's talk about what happened and let's learn the lessons and let's go forward, because we have the fall and then we have to do vaccines. And we are making the same mistake over and over and over. We have learned nothing, absolutely nothing. You have a president of the United States who still won't wear a mask. Every projection says you could save 60,000, 80,000 lives. He's still fighting with the scientists. He's still having political influence over the CDC and over the NIH. And he's controlling health news through his political lens. Look at the mistakes and the mistakes that we made in New York. The federal government was in charge of testing early on. And they were slow and they were incompetent. The state, in retrospect, I would have taken over the testing very early. We were the first state to mandate masks, but I wish I had done that earlier. We were told that asymptomatic spread wasn't possible. And that created many issues because we were told you have to be sneezing, coughing, et cetera, to transmit the disease. That was just wrong. And that was just a bad fact. And we operated on that. We were told it was a China virus. It was not a China virus. It was a European virus. It came from Italy, France, Spain. And the virus came to New York for months before we had any idea. The incompetence is breathtaking. At least let's learn from it. You know, fool me once.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.